The term mental illness refers to a number of emotional and mental disturbances that involve abnormal changes in personality and in behavior. You watched a video on one such person who has a mental illness, specifically schizophrenia, prior to seeing this, looking at this lecture. So the medications we're going to be looking at in this section are used to treat these type of disorders and are classified as antipsychotics. The objectives for this section of the lecture are that you should be able to identify 4 types of antipsychotic medications. You should be able to describe the clinical indications for antipsychotic medications, describe the adverse effects of antipsychotic medications, and explain the actions and advantages of atypical antipsychotic medications. Now, prior to us really getting into the medications, do want to make sure we have our terminology straight when we're talking about mental illness. And first question to think about is, what is psychosis? And a psychosis is a medical condition characterized by a disturbance of thought processes, delusions, and hallucinations, most common being schizophrenia. The second thing we need to talk about in mental illness is that of anxiety. Anxiety is a common emotion that occurs whenever there is an uncertainty or fear. We talked a little bit earlier about some medications, specifically the benzodiazepines, that we use to treat people who are having anxiety issues. And then the third term that we frequently hear surrounding mental illness is that of a neurosis. And a neurosis is that of an irrational fear. It's that extreme fear going on when we're talking about someone who can't go out of their house because, they're so afraid of being around people. That is more of a neuroses than it even is an anxiety. Within the spectrum of mental illness, though, there are 2 neurotransmitters that we're going to be talking about. And those are the neurotransmitters of dopamine and serotonin. And so when we're talking about medications that treat psychotic episodes, we're talking about medications that are going to deal with regulating dopamine and serotonin in the brain. Let's take a look at what that looks like. How exactly do antipsychotic medications work? Dopamine and serotonin are 2 neurotransmitters, as we said, that are involved in psychotic behaviors. So antipsychotic drugs primarily prevent either dopamine or serotonin from binding to and activating receptors in the brain. And by decreasing the activity of the neurons, therefore we're able to decrease the psychotic behaviors and suppress the symptoms of illnesses such as schizophrenia. So there are really 4 classes of antipsychotic drugs, and they are the Phenothiazines, the Butyrophenones, the Thioxanthenes, and the atypical antipsychotic drugs. And what we're going to do is we're going to take a brief look at each of these in a little bit more detail. So we're going to start with the Phenothiazines. These drugs block dopamine receptors to a greater degree than they block the serotonin receptors. So you see more dopamine blocking and less serotonin blocking. The therapeutic effects of these drugs are to reduce the bizarre behaviors, hallucinations, and irrational thoughts connected along with the psychoses, and to try to do that without significantly depressing other intellectual functions. In addition, though, you have to understand that these medications may also affect other receptors in the body. And this can include anticholinergic, antihistaminic, alpha-adrenergic blocking, and antiemetic effects throughout the body. So therefore, we will see some of these common side effects or adverse effects coming of using the phenothiazines, such as dry mouth, constipation, visual disturbances, and sedation due to the anticholinergic and antihistaminic effects. And if you remember back from what we talked about before, our alpha-adrenergic blockers can reduce blood pressure and cause orthostatic hypotension. So phenothiazines having the alpha-adrenergic effect may also cause orthostatic hypotension. Now, whenever we're talking about medications that deal with dopamine, we have the possibility of something called extrapyramidal syndrome. Extrapyramidal syndrome is a group of things that we see in the body when we start blocking dopamine. And these are a couple of categories of symptoms that we will see surrounding extrapyramidal syndrome. The first is a dystonic reaction, and in this case it's characterized by muscle spasms and twitching and facial grimacing. You can also see what's called akaesthesia, and that refers to a continuous body movement where an individual is restless and just like constantly paces about. And Parkinsonism is movements that develop as a result of the muscles become rigid and they get tremors, and you will start to see like that shuffling kind of gait as you would in someone who has Parkinson's disease. Now, the one thing about these three pieces of EPS is that by reducing the dosage or discontinuing the medication, the symptoms will usually improve or even totally disappear. However, there's a fourth one on here, and that one's called tardive dyskinesia. Tardive dyskinesia involves involuntary muscle movements, particularly of the lips, the jaw, and the tongue, and the extremities. You'll see the lips constantly moving or the tongue darting in and out. And one of the classic symptoms is something called pill rolling, where it would look as if you had a pill between your fingertips and you were rolling it around. Now, these symptoms, different from the other three, appear when the dosage of the medication is reduced or discontinued. So the only way to battle against these is to increase the dosage of the medication. So unfortunately, what happens if you need to take someone off of one of these medications and they have developed tardive dyskinesia, it'll get worse and it probably will never go away. The only way to get rid of it is put them back on a medication that blocks dopamine. Many of these reactions are what cause people to be non-compliant with their medications. These are some pretty nasty side effects that they have here, and so they won't take their meds because they don't like the reaction that their body has when they're on them. And if you think back again to Heather, you probably saw a number, or you should have seen a number of these type of activities going on with her, indicating that she's been on some antipsychotic medications for probably most of her life. Now, the second medications that we've mentioned that are antipsychotics are the Butyrophenones. These, again, block dopamine receptors more than they do serotonin receptors. But however, they do produce a little lower incidence of those peripheral nervous system effects. So you see a little less the dry mouth and sedation with them. But you do see a greater amount of those muscle disturbances coming along with these medications. So it's a trade-off, one for the other. The adverse effects of the butyrophenones are very similar to that of the phenothiazines. However, they have a much more higher incidence of the extrapyramidal symptoms. And so therefore they have a high potential to develop tardive dyskinesia with the butyrophenones. The thioxanthenes, let me pronounce it correctly, thioxanthenes, have, again, a chemical structure that's very similar to the phenothiazines and the butyrophenones, in that they work primarily by blocking the effects of the dopamine in the body. And similar to butyrophenone, again, we see a high incidence of extrapyramidal syndromes with these medications. In addition, we see drowsiness and that orthostatic hypotension with the thioxanthenes. So something to be aware of if someone is on one of these medications. They're going to need to be careful getting up from a standing position or from a lying position. They're going to have to take it in stages because they probably are going to experience some of that orthostatic or postural hypertension issues. The last group then is the atypical antipsychotic drugs, the ones that don't fit into the categories like the others. And the reason they don't is because they actually work by blocking the serotonin receptors more so than the dopamine receptors. So they're still working with those neurotransmitters, but they're more effective on serotonin and less effect on dopamine. As a result, they have a lot less incidence of the EPS effects, the tardive dyskinesia, and the neuroleptic malignant syndrome. Even though it's still possible, they are much lower in those incidents. Now, the downside, though, is that we have some other things that are frequently affected by the atypical antipsychotics, and that is we tend to see some metabolic issues, particularly people on these medications will tend to put on weight. We may see their triglycerides elevate, and we also have to watch them carefully and monitor blood glucose levels because they could develop diabetes. So less extrapyramidal syndrome effects, but we got to watch the metabolic effects with this medication. You did have a medication on your drug summaries that was an antipsychotic, and if you recall, that was Abilify. So now, thinking back, which one of these four medications, groups of medications, I should say, did Abilify fit into? Okay, Abilify is an atypical antipsychotic medication, and this group of antipsychotic medications, the atypicals, are most frequently prescribed just because of the decrease in the nasty side effects that you see. And these are the ones you're going to see your commercials for and that on TV. So this is probably our most frequently prescribed group of medications as far as schizophrenia and other psychoses go.